Hello, everybody. Welcome to Diva like Edwina. I am Anastasia, your host. Welcome to the Inner Diva segment of Diva like Edwina. Last time I discussed the situation that went on with Muffin is My Lovers, where her YouTube and Gmail, Smooches accessories, and all of that were hacked. And that was a part of my Inner Diva segment the last time. I actually wanted to talk about something else, but I decided to dedicate that one to Muffin. Muffin is my lover's, excuse me. I'm sorry, girlfriend, if you're watching this. I'm so sorry. Today, or this tonight, I should say, because this is nighttime here in Brewtown. I wanted to talk about a topic that is near and becoming dear to me. And this pertains to what I discussed briefly in my introduction to Diva like Edwina videos. I did a part one and a part two to that introduction. And I'm hoping I can contain everything in this one, in this just the one video, because this is going to be an overview of this topic. And the topic that I am overviewing tonight is bipolar disease. And if you watched my introduction video, you know that I was recently diagnosed as having bipolar 1 disorder and ADHD. Now, the diagnosis came after many, many years of suffering from both diseases. I've been suffering with this since childhood. And it took this long to get a diagnosis. I normally don't give my age away, but I will say that in another month, I will be 47 years old. And I just got a correct diagnosis as to what's going on. I will be discussing the ADHD part of my illness in a future Inner Diva segment. Right now, I want to focus on the bipolar disease, or what is commonly known as bipolar disorder. I say disease, I call bipolar a disease, ADHD, any mental health issue a disease. As I brought out in my introduction video, if it causes dis-ease, it is a disease. Alright, so I am going to be referencing a book that I purchased called The Everything Health Guide to Bipolar Disorder. And I bought this copy of this book at half price books for $7.48. And again, this is The Everything Health Guide to Bipolar Disorder, Reassuring Advice to Help You Cope by John P. Block or Bloch. I'm not quite sure how that's pronounced. PhD. Okay, so some of the things I'm going to be referencing will be from this particular book. I will say on a personal note that I always assumed that I knew what bipolar disease was. And before I was personally diagnosed, I always assumed that I'm trying to straighten out my necklace. There we go. I always assumed that bipolar disorder meant that you pretty much were you were depressed to the point where you wanted to kill yourself, which was one part of the disease, and then the other part of it is when you're not depressed, you're a raving lunatic, you're out angry with people, fighting folks, killing folks, bouncing off the walls, just all kinds of stuff. You were very promiscuous, you slept with anybody, and so that was pretty much my understanding of what bipolar is. And my bipolar, bipolar touches, I got two of the things I think I just mentioned, but the rest of it isn't what I personally experienced. So again, this segment here is to give an overview of the bipolar disease, what it is, and how to tell if you in fact are suffering from it. Again, going back to me personally, I have mental illnesses that runs on both sides of my family. Schizophrenia, and I'm trying to get this shirt right. Okay, schizophrenia on my dad's side, along with anxiety disorder. Also, Alzheimer's runs on my dad's side of the family. On my mother's side of the family, there is a history of mental disease as well, with several members of my family on my mother's side being hospitalized. Unfortunately, I never got to know exactly why these members were hospitalized, if they were diagnosed, if so, what it was. I suspect that my bipolar disorder came from my mom's side of the family due to things that I have personally witnessed as a child growing up. Okay, so that being said, what is the history behind bipolar disorder? And again, I'm going to be referencing, I can't talk, this book. Okay. Basically, in 1650, a British scientist named Richard Burton, Richard Burton, okay, wrote a landmark book called The Anatomy of Melancholia. And he indicates that, the book focused on melancholia, or what we call depression. And he did mention that he talked more about the depression. He didn't really emphasize the mania part of it, but this is the first time that anybody had even written a book about even the depressive part of it. So this is how it started, and I mean not started, but this is how the diagnosis and things like that for that began. And then as time went on, other researchers and different things discovered the other part that happens with a lot of people, which is the mania or manic side of the depression. And initially the diagnosis was manic depressive, and now the term is bipolar disorder, or I call bipolar disease. Again, I am diagnosed as bipolar 1, which unfortunately is the most serious form of bipolar disorder. It features 3 types of episodes: manic or manic depressive, or what they call mixed episodes, and at least one depressive episode. And I've experienced these episodes separately, and believe it or not, have experienced this at the same time. Manic and depressed at the same time. Don't ask me to explain that, but I've experienced it as well as other bipolar patients. There's also a bipolar 2, and although they say that it's not as serious as bipolar 1, I personally feel it's probably a little bit more insidious because the episodes aren't as marked. So it's very insidious. So I personally wouldn't say if someone that's diagnosed with bipolar 2 has a less serious form of bipolar. Okay, I simply would not say that. And then the manic episodes include rapid speech, high energy, euphoria, impulsive, just it. You clean the house from top to bottom. You clean out all the closets in your house, your neighbor's house, down the. You just have all of this going on uh when you're manic, and then when you're depressed, you can't even get out of bed. You're so depressed. Okay, so that's basically what it is. And then when you're manic, unfortunately, some people medicate that they try to come down off of that. If they get souped up too much, they take risks that they wouldn't normally take, like they go out and have sex with anybody, or you jump off of something, just really risky behavior, gambling, that kind of stuff when they're manic. And then the depressive episodes, again, you can't get out of bed. You basically just want to die. I mean, and there are physical symptoms with bipolar also. Whether you got one or two. I personally experience pain with nerve endings, headache, swelling, problems, skin problems with skin, acne breakouts. There's a host of physical symptoms that show up with bipolar, and that's part of the reason also it takes so long to get a correct diagnosis, because bipolar mimics thyroid problems and a host of other physical issues. So I don't have a lot of time here for this part because I have a little bit over a minute left. But I just wanted to kind of give an overview, and I think what I am going to do is go ahead and give a further overview as well, because this was kind of quick and kind of general, and there are other issues that individuals with bipolar face, and then also I want to give like some symptoms and things, so you to kind of help and encourage those who think that they may have bipolar disorder to by all means seek help. All right, so I'm going to stop this video here, and then I'm going to pick up with part 2 of the overview of bipolar disorder. And this is the Inner Diva segment of Diva Like Edwina. I will see you in just one moment.